The Neonatal Intensive Care app is a useful tool for neonatal nurses, practitioners, and physicians in emergency situations. It also saves the patient's information and keeps track of the adjusted gestational ages. It automatically recalculates medication doses and fluid requirements when daily weights are entered for each patient. For the purpose of this presentation, the neonate's gestation is 25 weeks and weighs 610 grams. When resuscitating any patient, establishing an airway needs to be accomplished before anything else. The intubation tab in this app lets the provider know what size endotracheal tube is appropriate for a neonate according to the weight and gestation. It also has the CuraSurf dose that will be given. The fetus starts to produce surfactant around the 26th week. Surfactant is a liquid produced by the lungs that decreases the surface tension, making the lungs more pliable and prevents them from collapsing. Premature infants less than 35 weeks gestation have not produced enough surfactant and will require the synthetic form to be given. In an emergency delivery of a very preterm neonate, there are usually many healthcare providers assisting in the resuscitation. As someone is establishing an airway, the baby is quickly placed in a bag to prevent heat loss. Plastic bag at delivery and early care tabs are quick reminders of what gestational age the plastic bag is used for and the pressures used when hand ventilating the neonate. Another team member watches the clock or activates the APGAR timer and informs the physician when the neonate is 1, 5, 10, 15, and 20 minutes of age for APGAR scoring. The APGAR tab saves the scores. This will help the healthcare provider accurately record the scores in the health record. As soon as an airway is established, umbilical lines are placed for emergency medication administration. The UAC/UVC tab gives the provider the specific measurements for line placement. The umbilical arterial line is used for obtaining blood gases and lab tests. The umbilical venous line is mainly used for fluid replacement and medication administration. Once the UAC and/or UVC is in place, emergency medications can be given. The Resuscitation Drugs tab and the Infusions tab calculates the emergency drug doses according to the baby's weight. The Fluids Requirements tab calculates the IV fluid rates according to the baby's weight. If the baby is in need of emergency blood transfusion, the Blood Product tab allows the provider to quickly calculate how much blood needs to be ordered. Prior to the delivery, an average weight for a baby born at 25 weeks can be entered into the app. The information in all the tabs will automatically be set for that weight. When the baby is stable, he or she can be added to the patient list with the correct weight and gestation. The app will make daily gestational age corrections. When the provider enters a daily working weight, the information in the tabs will be updated for each patient. The emergency tabs are extremely useful in emergency situations. There are several other tabs that are just as useful when caring for neonates from 22 weeks to 40+ weeks. Whether the mother is a patient on bed rest in labor and delivery and has started contracting, or a walk-in involved in a motor vehicle accident and bleeding heavily, the impending delivery of a very preterm neonate can be very stressful. The Neonatal Intensive Care app does the medication calculations and equipment measurements, allowing the neonatal team to resuscitate the baby without having to stop and do the calculations themselves. When stable, the baby is added to the patient list in the app with the correct gestation and weight. The app updates the gestational age and calculations for fluids and medications daily.